Oh, perfect. Okay. All right. And on that note, I am going to share my screen and we will get started. Okay. All right. So hello, everyone. Once again, thank you so much for joining us today. Hopefully it's a convenient time for all of you. We're super excited to be speaking with you guys about the Summer Institutes. Whether you have applied, whether you're thinking about applying or have just been accepted, hopefully we'll get you some good information today, get a lot of your questions answered. My name is Susan. I am the Institute's project manager at Engineering World Health. I started with EWH just over a year ago at this point. I worked primarily last year on our virtual programs because we kind of made that transition during COVID. And then I helped out our other project manager as we were able to restart programs in the summer, in-person programs. So that was very exciting. We're super glad to be able to be back on the ground and in person again, kind of doing what Engineering World Health was meant to do from the start. We have transitioned a bit this fall in our office. And so I am now taking on most of the project management and admin for all of the in-person institutes programs. So that is what brings me here, speaking to some applicants and kind of getting things going. So I'm really excited to get to know some of you all. And I will say that I don't have any background in engineering. So I don't know anything about the curriculum, probably can't help you out in the hospitals, but my background is more in study abroad, and I've worked with international volunteers in a couple different countries in Central America before. So I'm super excited to be working with students in that capacity again. And I will hand it over to Claire, who is our other EWH representative here.
Yes, hello everyone. I'm happy that you guys have been able to make it for this info session. My name is Claire, and I recently joined EWH as the biomedical engineering and education consultant. A bit of my background with Engineering World Health: I was a student just like what you guys are all applying for in Uganda for the winter program with the University from Australia, UNSW. Then I went on to be an OTGC in Rwanda 2 times. And then that is what led me to come full-time to get on board full-time with the team at Engineering World Health. My education background, I did a diploma in electrical engineering in Uganda. Then I went on to do a bachelor's in biomedical engineering. So that's a little bit of a sneak peek into my education background and my work background in terms of Engineering World Health. Yes, I'm excited to have you all here.
Wonderful. Thank you very much, Claire. Okay, I am going to start with just a little bit of background about EWH as an organization. So EWH was founded in 2001 with the goal of engaging university students to help improve healthcare delivery in clinics and hospitals in low resource countries. So that's kind of the overall mission, why we started. 20 years later, we have really expanded into a lot of different facets. We kind of have our wheel right there that you can take a look at and learn more about all of the different things that we do on our website. But today, of course, we're going to be focusing on our summer institutes. The first summer institute took place in Nicaragua, although it was not called that at the time. Our founder, Dr. Robert Malkin, was there with the group of students and essentially founded EWH to start this sort of program where he would bring students, repair medical equipment in these sorts of environments. And so that really is the basis for why EWH exists. And of course, we've had to pivot because of COVID, obviously, but then just as time has passed and we've expanded and changed, we have really grown to encompass a lot of different facets. But Summer Institutes is really, in my opinion, kind of what my favorite part about EWH, I will say. So why do we offer the institutes? I just gave you kind of a very slight bit of background about how they initially started in Nicaragua. But many low resource hospitals around the world are forced to rely on donated medical equipment to treat patients. And while this sounds like it could be a good solution in theory, of course, there's good intentioned companies or individuals, professors, medical professionals, whoever it may be that's coordinating these donations, it doesn't always turn out to be so beneficial in actuality. And this is for a variety of reasons. It could be that the piece of equipment isn't compatible with the hospital in the country that it has been donated to. Perhaps there's no user manual, or if there is one, then it's in the wrong language. Perhaps the staff at the hospital don't know how to use the equipment, or there's no spare parts, no helpline, things like that. So unfortunately, when a lot of this equipment is donated, it ends up in what we call at EWH an equipment graveyard. And that photo right there shows you an example of an equipment graveyard. And that's essentially just a large room or storage unit. Sometimes it's outside, sometimes inside. There's really, I've seen quite a few different varieties of this sort of situation when I was able to visit the Summer Institute in Guatemala last summer. So I can assure you that these do really exist. So this is kind of what happens when donations are made, but not in a way that is sustainable for the hospital. And so then the equipment just ends up sitting there, which of course is not good for the patients, not good for the hospital. It's very inefficient, and of course is not helping anyone. So on top of that, the equipment that does arrive usable, it falls out of service much quicker than equipment in a wealthier nation would that has more resources. And this is for a lot of the same reasons too. There could be more wear and tear because things are outside or the insulation is not the same in the hospital that's been receiving the donations. Maybe there's not trained technicians in that part of the world who understand how to repair it or to know how to repair it. So bottom line is that when medical equipment breaks in these sorts of environments, it often stays broken. And as you can imagine, this has very negative effects on healthcare. The most obvious one being that patients either have to wait or travel to receive treatment, or perhaps they can't be treated at all in that part of the world or in that hospital. Safety is compromised. If a piece of equipment is malfunctioning, isn't calibrated properly, that could lead to the wrong diagnosis, which of course is very dangerous. And then on top of that, efficiency and revenue are also diminished. So that kind of creates a cycle that really feeds into each other. In terms of if a hospital isn't able to perform a procedure, they lose that money, which gives them even less resources in order to repair the equipment that needs repairing. So this problem is really what we're aiming to tackle with the Summer Institutes. And what you can do to help out with that is participate in one of our institutes. So overall, institutes provide intensive hands-on training to university students and young professionals, I will add, and place them in hospitals in low resource areas to serve as volunteer biomedical engineering technicians. A little overview of our 2023 Summer Institutes. I will say these are our two open enrollment programs. So we've got Guatemala and we've got Uganda. The dates are quite similar. They're both 9 weeks long. Guatemala just starts a few days prior to Uganda. We do have another program that I think some of you are here for, maybe not, but the Nepal program is a little bit different. That one's exclusive to students who are attending Denmark Technical University. So that's why you don't see it up here on the screen, is because that one is only students who attend DTU can go to the Nepal program. So we're kind of focusing on our open enrollment programs today, which means that you can apply from any university across the world. And we had students last summer from Liberia, Germany, Japan, Spain, Denmark, United States. So really, really a diverse crowd in our institute programs, which we think is awesome. On top of that, we also work with local students. So the international students are from all over the world. There'll be probably between 10 and 20, kind of depending on how numbers work out, between 10 and 20 international students in each program, joined by between 5 and 10 local students in each program. We work with local partners in both of those countries as well. In Guatemala, we work with a tourism agency called Do Guatemala. So they work with international volunteers of all kinds year round, and we've been working with them for years, ever since the Guatemala program started in 2014. And then in Uganda, we work with Makerere University, where Claire went, and that is in Kampala. So we did have a really successful program in Guatemala last summer as our first summer back post-COVID. We were not able to go to Uganda last summer because COVID restrictions were still not conducive to student travel. But we have a really long-standing relationship with Makerere University in Uganda. And so we're super, super excited to be back there. A little bit more about the program, kind of what you're going to be doing in the day-to-day. Each program is 2 months, 9 weeks to be exact. The first 4 weeks will be your training month. So you will be participating in lab, lecture, that is focused on biomedical instrumentation, and that's specifically biomedical equipment repair in low resource environments. So you're going to be learning how to make repairs with limited resources, kind of when perhaps you have a system that you know to follow if you're at home or kind of doing your regular work, but that might not be possible in Guatemala or Uganda. So that is kind of what the course focuses on, as well as language training. In Guatemala, it is pretty 50-50 in terms of language training and technical training, because there is no English spoken in the hospitals in Guatemala. I mean, you might come across one or two people who happen to speak English, but Spanish, we really focus on that during the first month because it's going to be super important for students to have a basic understanding of Spanish. So you'll do Spanish classes in the morning and then take your lab and lecture in the afternoons. In Uganda, English is one of the official languages in Uganda. So we provide Luganda lessons as well, because that's a neat experience, and it could be useful too. But since English is more widely spoken in Uganda, it's not quite such a 50-50 split. And then after your month of training, you will transition into your hospital placement for the second 5 weeks of the program. After you've spent 4 weeks preparing, learning, getting adjusted to the country, and you'll do that all as one group as well. We'll break you up into groups of between 2 and 4 students, most likely, to your separate hospital placements. And those are in different cities throughout the country. So a little bit more detail on month 1 in the classroom. As I said, you'll study the operation, function, and design of medical and lab equipment commonly found in hospitals. You'll study the local language. And again, this really is focused on kind of how to make these repairs when limited resources are available. So that is something that's super unique to the Institute programs. It's learning how to be innovative, kind of think outside the box. We have lots of different textbooks and resources for you guys to, of course, while you're taking the course, and then also while you're in the hospital as well. We have a very wide range of manuals, flowcharts, things like that you'll be able to access. Also during month 1, you will be able to visit the hospital as a group with your instructor and with your on-the-ground coordinators. We say OTGC for short, so I always have to remind myself to say it fully for the first time. So on-the-ground coordinators, those are your 2 in-person summer staff who will be with you in Guatemala and Uganda. So you'll get to visit the hospital as a group with your instructor, with your OTGCs, to kind of get your feet wet before you head off to your hospital placement. And then you also will get to experience a cultural outing with your group. That's also included in our program. And that has nothing to do with engineering. It'll just be something fun to learn about the country that you are living in. So month 2, hospital placements, they're really exciting stuff. So in the hospitals, you primarily will be fixing equipment. That's going to be the number one thing that you'll do in your day-to-day is fixing medical equipment that technicians and hospital staff bring you. You also may be translating manuals, developing user guides. That's really important as well, so that staff will know how to continue to operate the equipment that you fix. We also have students do some paperwork, kind of some other side projects as well during that second month. One of those things could be a secondary project. So we also have incorporated that into your program tuition, as well as funds for a secondary project. And so that essentially is a project that you will do that doesn't necessarily have to be related to engineering. It could be technical if you would like it to, but we really encourage students to talk with hospital staff, form those relationships, and learn about the specific needs of that hospital in order to figure out what to do for their secondary project. So as an example, we've had groups in Guatemala this past summer. We did have one group do something on the more technical side, and they created a call system that went from patient beds to a nurse's desk. And if you choose not to go the more technical route, we've had students in the past do things like paint a mural or create privacy curtains for there was like a room with a bunch of different female patients' beds, and they created a system where they would have curtains around their beds to give them a little bit of privacy. So that's kind of an idea of what you could do for your secondary project. And then, of course, on top of all of the repairs and the technical experience, you will gain really, really awesome interpersonal skills. This is a really, really unique opportunity to get to know a country in a way that tourists just don't. You'll be able to build relationships with staff and technicians, really get to know them, kind of what their work environment is like, what they really need from people who are volunteering, whether they need volunteers. That would also be a good question that we're always keeping in mind. So it is also quite a unique experience in the sense that you'll be able to live and work independently during that second month. So as I said, you'll be split up into smaller groups of 2 to 4 students. And we will provide your accommodation and everything like that, but it'll be up to you just to go to your hospital every day, kind of take that responsibility on, which I think most students find really cool, really exciting. We'll of course be supporting you from, in my case, from North Carolina, in Claire's case, from Uganda. But then on top of that, you'll have your on-the-ground coordinators. So that's, just to reiterate, those are two seasonal staff that will be with you in country. They're with you the entire first month, and then for the second month, they'll rotate around different hospital placements. So again, as I said, it is a really, really unique experience to immerse yourself, a new language, a new culture, a totally new environment, get to work with brand new people, and really apply your skills in a very practical way. I know that that is super meaningful for, I know personally in Guatemala that I saw and spoke with some students on that program. And I know that that is a very common sentiment that our program alumni feel. And then, of course, we hope you will have fun and travel your program country on the weekends. That's obviously a very nice perk of the program. Your typical work schedule will be Monday through Friday, mostly full-time, according to what your hospital supervisor would like from you, but you will have weekends free. So that is nice to know, I think. So we have got right here a couple more details about the logistics of both programs. Guatemala in that first column, Uganda in the second. As I said, they're both 9 weeks. So the structure is the same in terms of there is a course, your training month for the first 4 weeks, hospital placements for the second 5 weeks. The dates just vary slightly. First month location in Guatemala is Xela. That's about 4 hours from the capital. And I believe it's the second largest city in Guatemala, if I'm remembering correctly. And then Kampala is the capital of Uganda. In Guatemala, we've got Spanish as our language. In Uganda, we've got Luganda, some other indigenous languages as well. And then housing, I know that is not very specific, that last row, and that's because it really kind of varies depending on your hospital placement. We were not able to use homestays this past summer because we were very cautiously restarting programs after COVID. However, we actually do have a winter program right now that is up and running in Guatemala, and we are using homestays again. So we're super, super excited about that because that has always been a really beneficial component of the programs in the past. So if all continues to go according to plan, we will use homestays in as many cases as possible, but it also could be kind of a rental situation, a dorm, that sort of thing. So that is really kind of dependent on your hospital placement in that case. Tuition finances. So tuition for both programs is $8,500. That is for the whole 9 weeks. If you have not applied yet, I would definitely encourage you in the application packet to read the terms and conditions for each program to see exactly what's included and exactly what's not included in the program fee. We want to be very transparent about that. And then as some of you received today, we have a complete cost breakdown that's included in your welcome packet. So you can see exactly what is going where for what things. So it's quite comprehensive. It's not 100% all inclusive, but it includes accommodation throughout the entire program, most meals, excuse me, my phone's ringing. Let me just turn that off. Most meals, or some meals, some transportation, everything related to the course. So your lab supplies, your textbook, all the staff that are going to be there, emergency insurance. So again, you can find details in the documents that you have received. You also can apply for financial aid from Engineering World Health. That is certainly an option because we really, really want to do everything that we can to get that number lower for you. I also would encourage you to speak with your universities as well about options for funding there. If you go to that link, kind of separate from the universities, there are a lot of different grants and scholarships you can apply for at that link that we've kind of compiled together for you. And then if you are able, and if you would like to apply for academic credit within your university, that is certainly an option. And I know that opens up a lot of other scholarship opportunities too, if it does count for academic credit. The course isn't automatically credit transferable just because we're a nonprofit and we're not an accredited academic institution. However, we have had students in the past petition to receive credit for the course, and they've been successful in doing so. So we're happy to provide whatever you may need to help with your fundraising, like official acceptance letters, kind of syllabus. We can give you a final exam if that's required, although it's not part of the course the way that we have it now. So yes, as I said, we want to be super transparent about what you are getting and really, really work together so we can get that tuition number down. All right, so application process. We have 2 application deadlines. The first one has already passed. That was our early deadline in December. So our final application deadline is going to be February 1st. In order to apply, you can visit that link right there at the bottom of the screen. You'll pay a $25 application fee, and then you'll complete the written part of the application, upload your transcripts. There's a couple of short essays, really more like long answers, I think. That's nothing too intense. And then we also do interview all of our applicants as well. All right. So after your program, you can, of course, share about your experience with other students. We actually have a lot of alumni do info sessions like this one at their university or for a student club, things like that. We find that students really enjoy talking about what they did, and we really like that too, because I think it's meaningful in a different way to kind of hear from someone who did it themselves. You also can work as an OTGC. I really like to emphasize that too. We hire OTGCs for every program that we run. So this is a paid opportunity. On top of that, it's all travel expenses are covered as well. So flights, accommodation, meals, things like that. You'll get a living stipend. So if this is something you're really interested in, if you do a program, we really prioritize that for our OTGCs too. And we find that students, the longer they participate in the program, the more they kind of want to come back and continue and things like that. I think Claire is a great example of that, as she's been here for multiple summers and is now with us full time. So last thing I'll say about after your program, you really can add this very, very practical experience to your resume. You're going to be working in a real hospital with real medical equipment, real patients. It's not like a classroom situation. It's going to have an impact. I mean, you'll be working on a piece of equipment, hand it back to the doctor, and they'll use it right then and there. So I know that was something that students in Guatemala shared with me was really, really meaningful and honestly emotional at times to them. So I think that that's something that is just really unique about the institutes that I hope that you all find appealing as well. So I am going to leave this contact slide up right here. We've got our Summer Institute email address there, our website, all the social media things. That is all that I have in terms of presentation materials. We would be more than happy to answer a few questions if anyone has any. Feel free to write them in the chat or speak up, however you like. Well, Claire and I will stay on for a few minutes if anyone would prefer to ask a question not in front of a larger group. We'll definitely have this recording available as well. We'll send it out hopefully tomorrow, maybe next week, whenever that gets downloaded from the cloud. So yeah, feel free. Oh, I think we have one. I see one question in the chat. If Canadian citizens need a visa. That is something that I would have to double check on. I think that in most cases, oh, you're Guatemala though. No, for Guatemala, you don't. Citizens of the United States, Canada, and the EU, probably a lot of other countries as well. You don't need a visa for stays of less than 90 days. So that is quite convenient for the Guatemala program. The Uganda program, there is a visa application, but it's fairly simple. Well, again, thank you very much for coming, guys. Feel free to drop off if you need to go. Sorry about that interruption. That was odd. I really don't know what that was. Are there any vaccines required for Guatemala? So we do require certain vaccinations on the part of EWH. Those are a tetanus booster within 10 years of the program. It is a TB test within 1 year of the program. And then we do require a full COVID vaccination series as well. So that's on the part of EWH. Off the top of my head, I don't think there is anything that Guatemala specifically requires. Like Uganda, for example, you have to have a yellow fever vaccination card as well. Guatemala does not require that. So it's just those three, which are kind of EWH requirements, not necessarily Guatemala requirements. But we do encourage students also to kind of look at CDC's travel website and do follow your doctor's recommendations for any additional vaccinations that you're interested in or kind of have questions about. that's all in your information too, in the medical form and stuff. I know it's quite a lot to read through. Let's see. Doors was staying together in the same city and the same hospital. Okay, that is a good question. So it's not on your dashboard quite yet, this hospital preference form, but we will give you a hospital preference form. And if you would like to request each other, you can do so. At the moment, there's no reason why not, why you wouldn't be able to be with someone who you request in your hospital placement. I guess the only thing that I will say that we do have to keep in mind is sometimes a homestay will like only have one bedroom. And so we'll need to have 2 students of the same gender who are sharing that bedroom. Things like that, where like the sleeping arrangements would determine how many students are there and who exactly it is. So I guess I hesitate to kind of guarantee that right now, but if that's something that you request and have a preference for, it's very likely that we can work it out. And that's for the second month also, to clarify. So for the first month, everyone's together. Well, thanks, guys. Feel free to continue typing, continue asking questions, head out if you would like to, and you will have a recording coming your way shortly within the next week or so, I would say. Thank you so much for your time. Super excited for you guys who are already admitted. We're really looking forward to this summer. And for those of you who have not submitted applications, I would love to receive them by February 1st.
Thank you. Bye.
Bye. Thank you.
One quick question, actually. I saw that the COVID vaccine is program mandated. Are there religious or medical exemptions for that for students, or?
We have not been able to do that yet.
Okay.
Yeah, we certainly can look at it on a case-by-case basis. I will say that so far we have not been able to make any exceptions, but again, willing to take a look at it on a case-by-case basis.
Okay, thank you.
Yeah, sure.